So the first one is going to be practices in collaboration and cooperation with others involved in patient's care when warranted, respecting the expertise and medical legal responsibility of all parties. That one's pretty important. I feel like just being able to know what, if you're working with a physical therapist and also a pediatrician, and then you have the athlete as well, it's kind of important to know who's doing what, and then like where you stand as far as, what you need to do, and, collaborate with them to make sure that we're all on the same page and we're not, jumping all over the place in rehab or, in different things. Make sure we each know what's going on. And it's like specifically with the like what the injury is and all of that kind of stuff. So I feel like that one's pretty important.
No, I agree, especially when you get into like what you said, like the cross clinical, like if we're working with other doctors from somewhere else, like making sure that everybody's on the same page, even though we're all technically like doing something different with them. Yeah,
Yeah.
definitely. I feel like it can get confusing too, because I feel like if you're not working together, I've seen it happen before where like one doctor will tell you one thing and then you go to another one and they tell you something totally different. So like if
Yeah.
we're all on the same page, then the patient will be too.
Yeah.
Yeah, I
That one's
agree.
pretty important.
Um, the first one that I did was um communicates effectively and truthfully with patients. Excuse my fan, it
Very
shakes.
good.
Um, communicates effect communicates effectively and truthfully with patients and other persons involved in the patient's program. So basically what you did, but then under that it says demonstrates respect for cultural diversity and understanding of the impact of cultural and religious values. So it's like a sub point of the one that you chose actually. Um, but basically the reason that I chose specifically the sub point was because of the cultural diversity and understanding the impact of it, because like it goes back to everything that we've been doing basically like all week and the week before, where it's important to understand like different points of the patient's life and how it can affect them. Like the chart that we were doing where it has like the environmental factors and like stuff like that. It's important to know where they're coming from and like the social demographics so that we can better like treat them and like gauge where they're at and what they need the most help with in their program, I guess.
Yeah, for sure. Yeah, even just shadowing at other places, you can definitely see like, different people come from very different backgrounds, and, some people have a difficult time getting rides to their clinics and, to their rehabs and stuff like that. And then also just, some people they're just different, they take things differently. Different cultures for sure. Like some people are very much against like specific medicines and stuff like that. So it's important to just kind of know where everyone's at, what your patient's ready to do and what they're able to do, and which where you can work with them. So it's pretty
Yeah.
important. So my next point was 1.3, demonstrates sound clinical judgment that is based upon current knowledge, evidence-based guidelines, and thoughtful and safe application of resources, treatments, and therapies. Like you said, this one kind of goes back to what we've been learning, these last couple weeks, going back to evidence-based practice and making sure that what we find in research is applicable to, what everyone else is doing. And we're, doing it safely, not going to hurt our patient, not giving them, false evidence, so they can actually trust us and, continue to see us, and we can, work on the same page together, and, not hurt them or anything as far as evidence-based practice goes. So that one's pretty
Yeah.
important too.
Yeah. I think it's also like again, it's going I mean obviously he did this on purpose, but like obviously what we've been doing the past 2 weeks is really important because like we're learning how to like look for the important ones or like the ones that like actually work or the ones that like actually have like I don't know what the word is. Like they have like important, like they have a meaning. They count, I guess. Like the sensitivity and the
Yeah.
specificity stuff, like making sure that it's like valid info. There you go, valid. They're
Yeah,
valid like research information. Yeah, so that we're not
yeah,
just like BSing whatever we're telling them. Like
yeah. I totally agree with that. Yeah,
especially like going into it, like for us, I feel like we're gonna be doing a lot of research for the next few years, like trying to figure out like we can only ask so many questions. So like trying to figure out
Yeah.
on our own like what's best. Like it's important that we have the good research, not just like what we the first article that popped up on Google. Like
Yeah, for sure.
yeah. Okay, and then my second
Like,
point,
we're gonna have a bunch of people around us and stuff too. So yeah.
yeah, yeah, kind of scary. I'm not gonna lie. That's a lot of research that I'm not prepared for.
Yeah.
My second point was under the social responsibility. It was strives to serve the profession and the community in a manner that benefits society at large. I feel
Hmm.
like this is one that might get like overlooked, I guess, and it kind of depends on like what kind of impact I guess you want to have in the athletic training community. Like if you're somebody that just wants to go to work every day, like that's cool. But I feel like especially like if you see something, like say something. So like when we researched like NATA and stuff, all the opportunities that NATA had to like get feedback from athletic trainers and like learn from their people and like they're doing research. They're using athletic trainers to do more research on athletic trainers so they can like better the profession and whatnot. And I feel like in turn that's automatically gonna like better the community that you're in because if you're making the profession a better place for like us to work in, then we're gonna want to help the community more. We're not just gonna be like dreading going to work every day and like dreading what we're doing. So I feel like that's also just important just for like I guess employee care,
Hmm.
like a good workplace and whatnot. And then also just like good for society.
Yeah. Another thing that I've seen like at one of the high schools I did is they had like a whole athletic training website for their school. So like students and like even parents and all of them could go in and see exactly like what they focus on, what they do as a whole. Like, they brought in like information from NATA. So like, the whole like school community too was able to see like, okay, this is what an athletic trainer is. This is why I can trust them. This is why, I can go and see them, do rehab through them and all that kind of stuff. They even had like exercises and stuff on there that parents could download and stuff like that. Um, just to, as a helping the community as a whole, I think that one kind of helps out too. I know it doesn't really specify specific communities, but that's always one of them. So
Yeah, I feel like that's an easy way to do it too. Like I feel like whenever people think of like helping the community, they think it's a lot of like getting out and like doing stuff. But like that's actually kind of cool having a website that just has all of that information on it. Like
um,
and also like it helps us be more than just like glorified water boys and girls. Like
yeah,
because I feel like that's what a lot of people still think. Like I know that when I tell people that I'm studying to be an athletic trainer, like that's what they assume that I'm gonna do is just hand out towels and water and that's it.
yeah,
So like I think that's really cool just to like one spread their word, but also it makes all the information like more easily accessible and it probably has like your last point, it probably has valid like research methods and like articles and stuff that are on the website too. So
yeah, yeah. So that was really cool. So
yeah.
yeah, I think that was a pretty good point as well. But yeah,
Yeah. I think that's it, I guess.
sounds